we're doing is a series of interviews with some of the senior team members. And I'm very fortunate today to have Caroline Deane with us. Caroline, do you want to just introduce yourself and tell us a bit about what you do and what keeps you busy?
Yes, thanks, John. Yep, I'm Caroline. I'm the Workforce Policy and Practice Lead at Scottish Care. And Scottish Care is a membership organisation, so we support predominantly independent and some third sector and voluntary care providers in Scotland. And we're a national organisation. We cover the whole of Scotland, and we, being in the workforce, obviously my remit is everything that's related to the social care workforce. So that includes learning and development, registration and regulation, and just anything that can impact on them in their working lives, and trying to make sure that we have a really robust workforce that has a voice, an effective voice, that's listened to and heard.
So it's a particularly challenging time, isn't it, Caroline, for the sector? So it'd be quite interesting just to get your perspective on what are some of the dynamics in the sector at the moment as we come out of COVID, and what's going to be different about the sector.
Absolutely. So I think the sector has had many challenges that were certainly pre-existing before COVID and before Brexit. There has been, unfortunately, really quite a systematic lack of funding that has been, given to probably both health and social care, but definitely, for social care over the last 10 plus years, I would have said. And it's had a really, really massive impact on the sector, where the wages have not grown, certainly not grown in line with the actual job and the role that is involved in what staff do. There's always got this kind of viewpoint that you can really walk into social care and start work, gain your qualifications later. And that was always a bit of a selling point for the sector, for people coming in who wanted to have, a really good career, that they had potential promotional areas and different places that they could move into. But the thing is that the sector's really not in that place anymore. It's very, very difficult for somebody completely new to just walk in the door. It's much more challenging. The people that we care for now have got much more complex needs, because of the eligibility criteria, for people receiving services. Ultimately, we have a growing population, and we don't have the numbers of workforce within our own country to deal with that. So there does have to be a big conversation around social care as to what we are going to expect social care to look like in the future.
Well, it's probably quite an appropriate moment to ask you about the Healthier Working Lives programme. I'm assuming that everyone who's watching this will have had a chance to look at the website and seen what Healthier Working Lives is all about. Well, I'd be interested, from your perspective, Caroline, why you're involved in it and why you think it's important today.
Absolutely. Well, I think the whole workforce is important. I think there's been a lot of focus over the last few years on the younger workforce, and while I recognise that, of course, we've got to build the workforce for the future, a huge part of that is building on the experience that is already in the sector. We have people that have been in the sector for many years, 10, 20, 30 years, that are hugely experienced, and we want that kind of succession planning. We want that ability to social care. There's only so much training, I think, that in a sense that you can do. You can show people how to do things, you can train practical aspects of the role, but I think a lot of the role comes from experience. It comes from working with people, being in different situations, reflecting on how you did things. Maybe you didn't do things as well with that, but further down the line you've learned from that, and that is such a massively important part, I think, of social care. I think, when we talk about social care, that is the heart of it. It's relationships. It's not just about going in and doing tasks for people. It's about making people feel better about their day, and supporting them to have the same experiences as we all have.
When you and I have talked before, one of the things you've said is that the co-design process is one of the things that you think is going to be such a good part of the process, where we actually involve the care worker in the process, tapping into the innovation that we know is probably already there, but just hasn't got the avenue to find its way out.
Absolutely. Yeah. I mean, I think that's fundamental. And I think having been at some things recently, I'm actually starting to get the feeling that the sector is quite far ahead of a lot of the people that is, the supporting bodies around it and some of the key stakeholders. They're having to adapt, they're having to be flexible, they're having to do it out in the field and in their working days, for many different reasons, staff shortages, just the sheer challenge of the role. I think that they're all very innovative. They're small business owners, they're working in a really challenging sector.
And they've
Um,
had to be innovative in a
and they have
sense.
to be. They don't have a choice, absolutely. If they're still here and they're still surviving in 2022 in social care in Scotland, they have to be innovative.
So, Caroline, I know you don't have your crystal ball exactly to hand, but if you were to try and say 5 years' time, what effect do you think what effect would you like to think the Healthier Working Lives programs had on the sector? And what are some of the changes to the status quo that have been affected?
I think, again, just making social care more understood, and I think more understood within the sector as well. I think sometimes because we have lots of different services and lots of different employers, we don't really have a banner under which social care sits. Like health in the NHS, the logo, the branding is very clear. And I think social care needs that. They need that for their own sense of identity. They need to be proud of who they are in the sector that they work for. And I think that Healthy Working Lives can hopefully do some of that, with the co-design if we're working with the sector. But I just think part of it's giving the sector a voice, giving a voice to the workforce, making sure that there's pathways and channels for them to be heard or to connect into other areas of research, so that they know where to go. Sometimes, you can feel you're very much in your own wee echo chamber. And it's difficult to break out, and particularly with the stresses that they've got. It's hard for them to look above and see what's going on because they're fighting fires in their day-to-day work every day. So we need to help them with that. We need to facilitate some of that and make it really clear how, if they've got a great idea, what networks do they tap into to try and take that forward? And that's one of the hopes of the legacy of Healthy Working Lives, that we will establish some of that.
On that note, Caroline, thank you. It's been lovely talking to you. Really
Thank
enjoyed.
you, John. Thanks very much.
All right.
Nice to speak to you too.